Hi, I'm Steve Leach. I'm director of Dartmouth-Hitchcock's Norris Cotton Cancer Center. It's never a good time to be diagnosed with cancer, but it's especially scary to receive a cancer diagnosis during these uncertain times, during these unprecedented times. We've taken special precautions to continue to provide care for our current cancer patients and newly diagnosed cancer patients within our cancer center. Things look a bit different, but patients are still receiving that same Norris Cotton Cancer Center, comprehensive cancer center care. Many of our physicians and nurses are conducting routine visits, increasingly by telephone or by secure video, allowing well patients receiving routine follow-up to be evaluated and interact with our providers from the comfort of their own homes. We've also made a number of changes in our policies regarding visits by patients and family. We're calling all of our patients the day before their appointment to inform them of these changes and to aid in their preparation. One of the difficult decisions we made was to say that except under certain circumstances, our patients would no longer be able to be accompanied by a family member. And this is for the safety of our patients, their family members, our providers, and our staff. Instead, what we're doing is, while patients are being evaluated by their provider, we're contacting family members who are often waiting outside in cars or at home by telephone and doing FaceTime or teleconference communication with family members, so everyone can still share in the news that's being delivered and in the treatment decisions that are being made, but just not invoking the risk that's entailed in a face-to-face contact in a small exam room. As many of our patients know, we deliver that same wonderful Norris Cotton Cancer Center level care at 6 sites throughout New Hampshire and Vermont, here in Lebanon, as well as in Manchester, Nashua, and Keene in southern New Hampshire, at Bennington in southwest Vermont, and at St. Johnsbury in northern Vermont. And we're following these same policies and continuing to deliver safe cancer care in all of our locations. In fact, every morning at 10:15, our leadership team from here in Lebanon and from all of our member organization sites throughout the 2 states gets together for a leadership huddle and ensures that we've addressed issues uniformly across all of our sites so that all of our cancer patients are getting the same care no matter where they're accessing our system. In the face of this unprecedented pandemic, we have made changes to our clinical research operation as well. For those patients who are receiving drugs on a therapeutic clinical trial, we are still fully functional in terms of our clinical trial activities, with some measures being taken to limit avoidable face-to-face interactions with research staff. For those clinical trials that don't involve the delivery of an actual therapeutic drug, we've put many of those on hold, again, in the interest of our patients, our providers, and our research staff, and we'll look forward to opening those as soon as the crisis is resolved. One of the things that uniquely characterizes our cancer center is our incredible patient and family support services, our individual nurse navigators, our different programs in music therapy, art therapy, Reiki therapy, our classes in yoga, meditation, nutrition. Many of these services in the face of the pandemic have had to be converted to remote services with our patient and family support staff frequently working from the safety of their homes and safely providing support to our patients through teleconferencing and telephone contacts. It's more important than ever that during this time of isolation, we still provide our patients with the same compassionate, patient-centered care. It's just that during these times, we've shifted to doing this remotely, again, in the interest of everyone's safety. If there was one thing that I wanted to impress upon our patients during this difficult time, it's that we are there for you. Our our physicians, our nurses, our staff are working all out to continue to provide our cancer patients with the cancer care that they need in a manner that's safe, that protects our patients, that protects their family members, and protects our staff, and continues our legacy of providing our patients with the very, very best in patient and family-centered care throughout their cancer journey. One of the things that's been most inspiring during this time of crisis is to see not only how our clinical staff have risen to the challenge, but how our researchers and scientists have repurposed their cancer research now to help the nation through this COVID-19 crisis. So our clinician scientists working with basic scientists at Dartmouth College and at the Geisel School of Medicine have repurposed their work in immunology, in pathology, in drug development to develop new ways to diagnose COVID-19 and to treat it. And this has been particularly inspiring to see this partnership come together in our combined Dartmouth College, Geisel School of Medicine, and Dartmouth-Hitchcock communities. So I know, and I want to remind our patients and our community that we will get through this together. DH strong, Upper Valley strong, and Northern New England strong.